Can we go over like kidney transplants because we never got
Sure.
to that in class?
Yep, we can do that. So kidney transplants, they don't really last as long as people like think that they will last. When you put in a foreign organ into somebody else, your body's going to attack it no matter what. So the better the match, like the better. Does that make sense? So like identical twins are like the most ideal because they have the same DNA. And then after that, it would be siblings, parents, stuff like that. So with transplants, you want to assess them they're always going to be on immunosuppressants for the rest of their lives. So you want to make sure that they're staying away from people with colds or that are sick because they're at higher risk of getting an infection. And if they get an infection, then it's more likely that kidney is going to be rejected earlier because their white blood cell is going to go up, and then they're going to be like, oh, I'm sick, and then also, ooh, I've got this thing in me that isn't mine. Let's attack it.
Immunosuppressants so that they won't, like their body won't attack the kidney or whatever?
Yeah.
Okay. And then they're susceptible to a lot of illness.
Yeah.
Okay.
Mm-hmm.
So how soon does the kidney that they put in like start taking over, like start working fully?
Right away, actually.
Right away?
Yeah,
Really?
I saw a kidney transplant one time, and there was urine coming out as soon as they attached the artery to it.
Wow.
So, yeah,
That's
it's super
crazy.
fast. So,
Then does stuff still like go to the other one, or does it just stay empty?
yeah, they do. So you've got your 2 kidneys, and then your bladder. They just put the kidney transplant like right there, unless there's cancer or something in here. So they just attach the artery to this kidney, but this one's still getting blood supply.
So they don't take that one out.
Mm-mm. Nope, unless there's like cancer or PKD, something that obstructs it. Because these 2 kidneys are still like, they still have a little bit of urine output, so we want to utilize them as much as we can. And then this kidney can kind of help subsidize it. Mm-hmm.
Okay. That's cool.
So with kidney transplants, you obviously have the possibility of rejection. There's a couple of different stages of rejection. The first one is hyperacute. And this one I like to think of like they're leaving the OR. They just got the kidney in and they're having blood clots already, you know. The body has already rejected it. Next is accelerated. This is going to be like while they're still in the hospital, so like 2 to 5 days.
These are stages of rejection?
Yeah, these are like when they're likely going to have, like what time frames that they can have a rejection.
Oh, okay, so they're not stages because you don't have hyperacute and then
Accelerated,
You
yeah.
don't do that?
No.
Oh, okay. So
Yeah, sorry, that was confusing.
So they're types of rejection.
Yeah. Then you've got acute, 4 days to 1 year. And then chronic is about 5 years. So unless it's a really like pretty much a perfect match, almost all kidney transplantees are gonna have some form of rejection. Like transplants usually only last about 5 to 10 years. So they're gonna be on some serious immunosuppression drugs to try and keep it in as long as they can. And you want to like make sure to teach them to wash their hands lots to try and avoid getting anything. President Clark had a kidney transplant, and in his office he's got like hand sanitizers and stuff so that when people walk in they can wash their hands and stuff so he doesn't get sick.
So how do you know if like say they were having a hyperacute rejection? Like, how would you know?
Some signs and symptoms of like the rejection is their white blood cell counts are going to go up.
Mm-hmm.
They're gonna be like their temperature is going to go up. What were the other signs and symptoms?
And these are the same signs and symptoms for each one of these?
Yeah.
Okay,
Mhm.
so they're all the same, just when it happens.
Except for chronic. Chronic is going to be more kind of like chronic kidney disease. It's just going to be slowly progressing, just a little faster than chronic kidney disease. They might like feel, they're going to have some pretty bad pain in the area that but you're going to want to make sure that like you distinguish the pain between rejection and they just cut me open, you know?
So, like, if they had a hyperacute rejection, like, would they still just keep it in, or what would they do?
They would take it out because you don't want your body attacking something.
So, like, with the accelerated and stuff, would they still take it out?
Yeah. Mm-hmm. They would.
So can these people get another kidney? Like, could they be put back on the transplant list
Mm-hmm.
when their kidney rejects?
Yep. I know someone who she had chronic kidney disease and then her sister donated a kidney to her and it rejected it like within a couple of days. And then her other sister donated another kidney to her and it accepted it. So, and then you can be put on the transplant list, but it's going to be at the bottom again. So.
I just have to wait.
Mm-hmm.
So, this is kind of weird, but, like, with that case, like, could they put the sister who rejected it, her kidney, like...
Back
what do they
into
do with
her?
it? Yeah.
I don't think so. No. I'm not positive, but I'm pretty sure that as soon as it's out, it's out.
Mm-hmm.
So, this is like the only time that the OR tries to makes people feel worse when they came in than when they leave.
Because when they get a kidney.
Yeah. So the people who are getting the kidney are going to feel better than they have in years, and the person who just gave a kidney is going to feel horrible. So, because there are other kidneys trying to make up for not having that extra kidney to work with,
Mm-hmm.
which your body has an amazing ability to compensate. So
So, with the people who get the kidney transplant, and if they reject it, what do they do in the meantime while they're waiting for
dialysis.
dialysis?
Mm-hmm. That's their only option, or they can just stop dialysis if they are tired of it.
Mm-hmm.
So it's pretty much like a part-time job.
Yeah, it
They're in there a
is.
lot.
I don't think we can do it.
All right. I think that that's the main of kidney transplants. They're going to want to assess carefully I's and O's. They're going to watch for hypertension. You're going to look at BUN and creatinine. Pretty much anything that all of the labs that you check with renal failure. Make sure that kidney's working, picking up the slack from those two kidneys that are kind of duds.